Are you always having malaria? Today you treat, 2 weeks later, the symptoms surface. A month later, symptoms surface. You keep treating malaria back to back, every week, every month. Is that you? There are several reasons why you'll be having recurrent malaria infection. Number one is weak immune system. As we all know, our immune system are like soldiers that fight against foreign substances when it invades the body. When your immune system is weak, it will not be strong enough to fight against this parasitic infection. 2. Excessive parasitic invasion. When malaria parasite invades your body, some of them goes to your liver to rest. At that point, you may not have any symptom at all. It keeps storing like that, then over time it spreads to your bloodstream. At that point, the malaria parasite in your body will be too much that it may not be treated at one phase of treatment. When you succeed in eliminating the first set of malaria parasites, after a week or after a month, the next one will surface and you keep treating and so on and so forth. Which brings me to number 3, which is improper malaria treatment. I always advise that if you want to do a malaria test, be very, very emphatic on them doing a thin or a thick film for you. In that way, you'll be able to know the exact quantity of malaria parasite present in your body. It could be a plus, 2 pluses, 3 pluses. When the doctor sees your test result and knows the amount of malaria parasite present in your body, the doctor will know the approach he or she will use to treat you. There are some malaria treatments that exist just 3 days. Sometimes you even need injections and pills at the same time. That is to show you the severity of the malaria parasite in your system. Number 4 is stress. Have you heard of stress-induced malaria? This doesn't necessarily mean that stress causes malaria directly. Like I said, when your body gets invaded by malaria parasites, some of them goes to the liver. They are just in your liver resting and they keep accumulating. Then when you find yourself in a period of stress and a lot of activities, you will break down with malaria. Because stress have the ability to subdue our immune system. So when your immune system is subdued, the malaria parasite that have rested in your liver will start reacting. And lastly, 5, abuse of malaria drugs. This abuse comes in 2 ways. We have the category of people that little headache, stomach ache, fever, this, that, they will not go and do tests. The first thing they will suggest is malaria. Thereby giving yourself self-medication. Then at the point that you have been taking malaria drugs at every point of any symptom, your body will now start acting as a resistance to malaria drugs. Which is why it is important that any symptom you have, run a diagnosis before you start treatment. We have a lot of sickness that have similar symptoms with malaria. It is not all fever, all headache, all body pain that is malaria. So go and run a diagnosis. The next set of people are those that don't complete their medication. Once you take malaria drugs, maybe 1 or 2 doses, you abandon the rest because you started feeling better. The whole body pains, fever, headache have vanished. You have succeeded in abusing that drug, and trust me, the malaria parasite, it's just the surface that have been scratched. So you may feel better in 2 weeks, 3 weeks, a month. The following month it starts again. That's because you have not treated it properly. So once you start a medication, make sure you finish it. So what's the solution to all of this? Ensure your immune system is active. Take vitamins. Treat properly. Don't abuse your drug. I've already mentioned that. Stop self-medication to avoid resistance of malaria drugs in your body. And lastly, reduce stress. It's what malaria do. Don't say I did not warn you. Please drop your questions in the comment section and don't forget to like, share, and follow for more.